Candida. We can make it together. The further from you, girl, the better. What? You're doing fine. Welcome. This is the Nisha Jackson Show. It's not the Tony Orlando and Dawn Show. And I'm Rusty Evers. She's Nisha Jackson. Now, the song Candida was Tony Orlando's first hit.
I had no idea.
You never heard that song?
No, you had to sing it for me, which was painful. It was painful.
Now, here's the funny thing. I talked to Tony Orlando about this song. He didn't know that it was a yeast problem.
I'm sure he didn't, because I don't think he would have been singing it. It probably wouldn't have been a #1 hit.
Yeah, it was a big hit. If you don't know the song, go get it. It's a good song.
Yeah, it's
but
real good. Just
do you remember the song at all?
Well, I kind of do a little bit now that you can sing it for me, but I might have to listen to Tony.
Tony does a good job. That's a good song. Anyway, so Candida is a song by Tony Orlando from 1970.
And it's still a #1 hit. It's just a #1 hit in your gut.
Okay. So what is, other than a hit song from the 1970s from Tony Orlando and Dawn, what is Candida, and is it good or is it bad?
Right. So again, this has been something that I've been talking about for years in the medical practice, and we've had lots and lots still medical professionals that don't think Candida is real.
What?
That it's not a real thing. We actually still have people, I would say the majority of medical professionals in the past have all discounted it. Candida is short for candidiasis, and candidiasis is an overgrowth of yeast. And it can be anywhere in your body. It can be in your mouth. It can be in your pelvic area. It could be on your feet, like fungus. It could be in your gut. And so today I want to talk about yeast in the gut.
Okay, why would a medical professional not think that is real?
I don't know.
Okay, I mean,
I don't have time today to talk about that because I'm going to get all wound up and upset. But
I want to see her wound up. I'm telling you what. Okay, so let's get into it.
Right. So Candida is an overgrowth of yeast because honestly, the main reason that people have it so much today, and it is a #1 hit, it's very, very common in people today, in people's guts today, because we eat so much sugar. And yeast loves to thrive in warm, sugary environments. So, I mean, if you think about it, a lot of times people get skin yeast infections during the summer, like women might get it in their bra line because they sweat, and then they get it along their bra line, or, men with their underwear, I'm not going to get into all that, but you know what I mean? Yeast likes to thrive in warm, sugary environment. So if our diet's really high in starch and really high in sugar, and it's in a warm place like the gut, it will thrive really well. So patients that come in that say, here, I'm going to describe the picture of too much yeast in your gut, which is really common, is people get migraines, they get headaches, they belch, they pass a lot of gas. They have digestive problems. It feels like sometimes their stomach's upset all the time, or nausea, like they'll eat and then within 10 or 15 minutes they feel sick to their stomach. Skin infections, skin problems is very, very common with too much yeast in the gut. So I have a story I want to tell you of a patient that I saw years ago, and I'll never forget it. She came in, and I love this lady, and she came in and I'd never seen her before, and she had big red boils all over her body, like really painful skin boils on her body, all over her body. And she had seen multiple allergy specialists, multiple dermatologists. She had been treated with steroids and antibiotics and all the things that actually cause the yeast to be worse. Right. And her diet was really bad. She was very overweight, and her diet was very toxic with lots of sugar and carbohydrates and processed carbohydrates that turn to sugar immediately upon entering your mouth. And the last dermatologist told her that his recommendation is that she take a bath in bleach.
What?
I'm not kidding. I'm not making this stuff up.
That's a good doctor.
And so I almost gasped when she said this, and I said, maybe we should try treating your gut first, because if you have skin problems, your issue most likely is your gut, because that's where many of the problems with your gut presents itself, is in your skin. So I identified right away because she had many of these other symptoms. And so we treated her. I treated her. I gave her medication to treat the yeast in her gut. I changed her diet. I put her on high dose probiotics. It's a very simple treatment program. And within about 3 weeks, she had 80% resolution of these boils. Now, she had been plagued with these for a long time.
Oh my gosh.
Like, you know, they would come and go. The antibiotics and steroids would make them better, and then they'd get worse again. And of course, all the other symptoms of the gut problems and issues with memory and concentration and being almost like ADD, which is another sign of Candida. Anyway, this has been years now. I still see her, and she's never had the problem again. She knows if her diet gets out of control that she just reels it back in, and she never has gotten these skin problems again. So I just want to say that that's kind of an extreme example of Candida, but it can present itself just in the skin without some of these other symptoms. But typically, Rusty, people will have gut problems. So, but the other thing is, and I hear this a lot with adults, is they get chronic ear infections because, again, think about yeast living in the ear. It's warm and it's moist and it likes to live in the ear. And so what happens is that they get antibiotics, and antibiotics cause a imbalance in the gut, right? It kills everything. Right. So it kills the good, the bad, everything. So if it kills the good bacteria that helps keep the yeast in balance, then you don't have anything to fight with. Does that make sense?
Sure.
So the problem with chronic ear infections with kids or adults is that you're constantly going on antibiotics, which constantly disrupts the gut, which constantly gives you an overriding issue with yeast in your system, like systemic yeast, like outside of the gut, like in your ear. So many times we actually don't need to treat an ear infection with antibiotics. What we should be doing is treating the person for Candida, because they actually have yeast in their ear that makes it feel like an infection.
Wow. Again, other than hearing the Tony Orlando song, I never heard about this stuff. Why is this not something with Candida? We don't hear about this.
I know. Well, we see it a lot in our office. And when I train medical professionals to do what we do in our offices, as far as testing and optimizing hormones, nutrient levels, brain chemistry, diet, all of the things that we do in our office, I always say, listen to the patient, because if they have these symptoms and their diet is poor, they're very likely to have Candida. And we give a questionnaire out, and you could just Google this. You can go to any Candida website and get this. It's a very common questionnaire. Take the questionnaire, and it will tell you how high your score is and if you're probably dealing with Candida symptoms. But it is something that should be treated, and we treat it pretty aggressively because it does affect the entire body, because whatever happens in your gut, Rusty, is going to be displayed in many other places in your body. So the gut is really important to keep healthy.
It all begins in the gut, doesn't it?
It all begins in the gut. Birth control pills also for girls put them at a higher risk of Candida. We have something called estrogen dominance, which means that the estrogen, and this is true for men too, their estrogen is more predominant than the other hormones, and an estrogen dominant state happens with birth control pills. And so women that are on birth control pills will be at a higher risk for developing too much yeast in the gut. Being on antibiotics, going on steroids, high stress, because stress interferes with the gut balance. And certainly the most common is high sugar processed carbohydrates in your diet, which is just the good old American diet.
Right. Okay. And so to work and get through this, call your office, nishajackson.com. That's probably the best place to get started on this. Yes?
Yeah, I believe, there are some natural supplements out there that if you just changed your diet and you were aggressively at changing your diet, getting rid of the sugar and all flour, like just get those two things out of your diet completely. Do it for a couple of weeks and then start on a very high potent probiotic. It's possible that you could arrest most of the symptoms and treat the yeast in the gut. We actually use a prescription medication and treat the yeast that way initially, just to get rid of it, because many people that come in, Rusty, are sick. Mm-hmm. They don't feel well. They've been struggling for a long time, and they really need to get it under control. So we choose to treat it with an antifungal medication first, and then start the patients on a very high potent probiotic and change their diet and optimize their other levels.
What is the definition of a high potent probiotic? Is it 20 billion? You see those different
50.
Numbers. Huh?
More than 50 billion CFUs. So, and many times they need to be refrigerated. Different brands need to be refrigerated, but more than 50 billion is what you need. And then we could do a whole show on what types of probiotics to take long-term, a prebiotic, a probiotic, so a postbiotic. So we're not going to get into that today because it's just important to always do the basics. Get your diet under control. Supplement. Probiotics are really important, keeping your gut in balance, getting the right bacteria in your gut so that you can absorb all the good food you're now eating and the supplements that you're taking.
And do you believe that a good probiotic has to be refrigerated? I mean, I've heard people say that if it's not refrigerated, it's not any good.
No, that's not true. There's some excellent high potency probiotics out there that do not need to be refrigerated. So don't worry about that. The most important thing is to if you have some of these symptoms, you've got skin problems, you've got gut problems. And I mean, a lot of people say, in fact, I know a couple people that are sort of close to me that say, oh, I just have gas all the time. That's just me. I just fart all the time. And it's really not normal to fart all the time.
My body's a symphony at night.
It's probably that you're not feeding yourself really good food. And it's true for animals too. It's very possible that your animal is not getting the best diet or having the best diet if they're passing gas. I guess maybe that's what I should say, is passing gas instead of farting.
Probably.
Maybe that would be more professional.
I think people get it. I think people get when you say passing gas that you're saying the other thing. All right. Anything else? You're ready to wrap this one up?
I'm going to wrap this one up. Don't you think that was important information to get out there?
Again, I thought it was a song. I didn't know. All right. Do yourself a favor. Go to nishajackson.com. Yes, Candida. We can make it together.
Hey, Google the song. Pull it up on Spotify or Apple, whatever.
Tony's a good friend of mine, too. The from you, girl, the better. Yeah! Get the book. Brilliant Burnout. Get the book. Get the book. Oh, yeah. Get NishaJackson.com.
We're done. We're done with this.
All right. We'll see you next time. I'm Rusty Humphries. She's Nisha Jackson. And this is The Nisha Jackson Show. Can't